Well, good morning, everyone. We welcome you here. It's an early start, but it's important for all of our guests and certainly for our speakers. We have the number of them on pretty tight schedules, so we'll try to have a tight schedule as well. But welcome to all of you on behalf of the World Affairs Council of Atlanta, CARE USA, and the Center for Strategic and International Studies in Washington. These three organizations have partnered up over the last 3 years to do this series on global health, starting with global health and water, global health and hunger, nutrition, and now health in Africa, focusing geographically, but also substantively on a continent that has such impact on these issues and in which we are deeply engaged. Later, we will have the privilege of having His Excellency Raila Odinga, the former Prime Minister of Kenya. He's accompanied by his wife. They will join us later, and we are privileged to have him here. He has spoken to the World Affairs Council of Atlanta in the past, and he's deeply knowledgeable, of course, about the wide range of issues that we will talk about today. Also want to welcome eventually. They will be here, but some of the delegation already here from the University of Barcelona, the master's and students and faculty from a program in corporate social responsibility, a master's program in that subject. Dr. Steve Olson of the Center for Ethics and Corporate Responsibility at GSU has organized this, and this day is a part of their residency here in Atlanta. They'll be visiting a number of companies talking about sustainability in the broadest context of that term and what is the socially responsible response that we should all have to the issues that are facing us. So welcome to them too. As you know, this is the third in this series, but simply put, this summit's purpose is to bring together key practitioner experts, academics, global business, NGO, and government leaders who are focused on health in Africa and who are driving the global discussion about how to address the unfinished agenda on that great continent. Well, we are deeply grateful to the sponsors of this summit. We could not do this, and certainly not offer it to all of that list of people, all of you, at no charge, without the great and strong support of the Coca-Cola Company, UPS, AGCO Corporation, U.S. Poultry and Egg Export Council's International Poultry Development Program, the Georgia State Robinson College of Business, the Center for Strategic and International Studies. All of these organizations have gone way out of their way, both in kind and financially, to support this endeavor today. Our supporting organizations also involved in both of those ways, the Center for Ethics and Corporate Responsibility. Thank you, Steve Olson and Dr. Rob Williams, who are here representing them. And another organization, you can look on the back of your program and see the description of Emergency USA. Dr. Laura Jacobson is on the board of that organization, and you will see that they are offering healthcare services, especially critical healthcare services in areas acutely affected by war and poverty. And Laura joined the council with her husband John, and I must say it was one of the greatest things. As a holiday gift for Laura, his spouse, they supported this conference, this summit today, and what a wonderful gift in that way. We have many cooperating organizations. In fact, one of the points of this gathering is to look on the back of that program and see the back of the program is the story. The story is the cluster, the set of organizations who are supporting and cooperating and sponsoring this day. Many of you represent those organizations. It's one reason we have a big room, and because we have all of these cooperating groups that mostly based in Atlanta are together cooperating to address health in Africa and health in the world. So I think that back page speaks loudly and powerfully about the collaborations that we endorse. We're not only grateful for the organizations, but it does show what we are trying to demonstrate and model here today. We hope that modeling is not just an association of people, but a way to come up with some synthetic ideas, some new thinking, some innovative thinking. As I said last night, and I've said many times with my colleagues, this is a day to be brazen and disruptive. If you're not prepared to operate under those adjectives, you're probably in the wrong place, because it's the only way with that kind of approach that we can be truly innovative and come up with the solutions we need. The other part of what is this program about, before I introduce Steve Morrison, is the other part of this program. Well, you say, as many of you have already said, it's a very powerful image. It does speak for itself. And we thank Mish Spink, our wonderful force of nature, who helps put on this whole conference, also for the design of this. But this is not about design. I thought this is the most powerful. We looked at hundreds of images. This is the image. This is what we wanted to say for a whole lot of reasons that all of you know better than I. But then I asked Care and Mish to look at the meta file, which describes, because I said, do we know who she is? We know she is powerful. We know she is concerned. We know she is determined. We know she's been through a lot. You can see that in the face. Well, it is, may I introduce you to Khadija Yusuf. She is 50 years old, has 5 living children, but has lost 6 due to various illnesses and health complications. To collect water, she walks to a nearby water hole where she fetches it using a coconut on a stick. The family recently joined a local village saving and loan association and are looking forward to building a better home. This will be the first development project they have ever participated in, and this one happens to be with CARE in Tanzania. If you talk about some kind of intervention, it was when we heard that story about Khadija. She's also Muslim in Tanzania, so it spoke to a lot of subjects. And so I wanted you to know her, and you could be introduced to her this morning. Finally, there are so many of you that are so important here to us, and all of you are in the room, and I won't go through that list. As they say, you know who you are. For me personally, for this organization, for this collaboration of the 3 partnerships, we are truly, truly grateful to you all. I would now like to ask for some words of welcome. Steve Morrison, my wonderful colleague and our partner on this endeavor, or as Helene Gale calls, our co-conspirator, Steve Morrison. Dr. Morrison is Senior Vice President, Director of Global Health Policy Center, Center for Strategic and International Studies. Steve.